Hey everyone, we've got another heart today. This is number 618 in our collection, and the heart would have sat in the chest like this, anterior surface towards the screen, the posterior surface towards the turntable, head or superior up here, legs are inferior down here, left over here, right over here, and we can see we've also got the trachea in this heart, and right off the bat it looks like we've got a right aortic arch, but we'll get to that later. Let's start off as we usually do, which is by finding what appears to be externally the right atrial appendage. And here we have an appendage that appears to be somewhat triangular, broad-based, or pyramidal, so let's go ahead and open up the heart there. And when we open up the heart here, we do see pectinate muscles that spill outside the confines of the appendage. You can see them up here, and you can see some down here as well. And then as we look into this atrium some more, we find the oval fossa here, which appears to be intact. We also find the coronary sinus here. And here is the Thebesian valve, which guards the orifice of the coronary sinus. And then, of course, whenever we think of the coronary sinus, it's important to also start thinking about the triangle of Koch. And here's the coronary sinus. Here is the tendon of Todaro. Here is the right-sided atrioventricular valve, which are structures that bound the triangle of Koch. So here is the triangle. And at its apex is where we would expect to find the atrioventricular node. So we'd expect that the AV node in this heart would live right here. When we look at this right-sided atrioventricular junction, we do find a valve that is guarding it. It does appear to have 3 leaflets. 1, 2, 3, and it does appear to have connections directly to the ventricular septum, consistent with the morphologic tricuspid valve. So here's the anterior leaflet, septal leaflet, and inferior leaflet. And as we look at the ventricle, there are coarse trabeculations consistent with a morphologic right ventricle. And then more importantly, there's also a septomarginal trabeculation here, aka a moderator band, also confirming that this is a morphologic right ventricle. And we can also see that the ventricular septum appears intact. As we come to the outflow tract here, we find a semilunar valve. It appears to have 3 leaflets, 1, 2, and 3, with 3 sinuses. 1 sinus here, 2nd sinus in here, 3rd sinus in here. And you can see that there's no coronary arteries arising from any of these sinuses, and that this valve is completely supported by muscle. There's no fibrous support here, all consistent with the morphologic pulmonary valve. It's also important to note that what we call the annulus, the round or oval structure for the semilunar valves, is actually not a true finding. You can see that the annulus of the pulmonary valve is actually a crown shape. So this round or oval annulus is a human construct, and while it's helpful, isn't a true anatomic structure. The true annulus of the semilunar valves is in this crown-shaped, and that applies to the aortic valve as well. Here's the pulmonary trunk. The pulmonary trunk gives rise to the left and the right pulmonary arteries. So once again, here's the pulmonary trunk. Here's the right pulmonary artery here, and then here's the left pulmonary artery here, and then here is the right pulmonary artery here that traverses posterior to the ascending aorta, which is here. Now let's go ahead and turn this heart to its back. Here's the posterior surface of the heart, and here we find the left atrial appendage. We find now a smooth-walled atrium consistent with a morphologic left atrium. Here is the posterior aspect of the oval fossa. Here are the horns of the oval fossa. And here is the mouth of the left atrial appendage here. And you can see that all the pectinate muscles are confined to inside this appendage, consistent with the morphologic left atrium. When we look at this left atrium, we do find the left atrioventricular junction now that is guarded by a left atrioventricular valve that has 2 leaflets. Here's one and here's the other. This atrioventricular valve does not have connections to the ventricular septum, consistent with the morphologic mitral valve. The ventricle that it's opening up into has fine crisscross trabeculations, consistent with the morphologic left ventricle. And then here we find a second semilunar valve. Once again, its annulus is truly semilunar, not round or oval shaped. And there's fibrous continuity between the anterior leaflet of the mitral valve and part of this semilunar valve. When we look into the sinuses here, we do see coronary arteries arising from it, consistent with the morphologic aortic valve. And then here is the ascending aorta, and we can follow this up here. So here's the ascending aorta. Now let's take a look at this aorta. Now when we look at this aorta, here's the ascending aorta. And right off the bat, we see it courses over the right bronchus. So this is a right-sided aortic arch. Let's try to straighten out these head and neck vessels. When we straighten out these head and neck vessels, we find that there is, in fact, mirror image branching. Here's the ascending aorta. Here is the left brachiocephalic. Here is the right carotid. And then here is the right subclavian. So once again, ascending aorta, left brachiocephalic, right carotid, and then right subclavian. And then here's the transverse arch and then the descending aorta. And you can see there's another structure here, which is actually an arterial duct that has been ligated. So presumably there was a left-sided arterial duct to the descending aorta, which means that there was very likely a vascular ring in this heart, which would have been formed then by a duct that would have then come across to the pulmonary arteries here. So here's the trachea. There would have been a duct to this side that would have completed the ring along with this left brachiocephalic artery. So we've got a heart that has otherwise normal intracardiac anatomy with a right-sided aortic arch with mirror image branching that did presumably have a vascular ring, but did undergo an arterial ductal ligation.